want to go ahead and call the meeting to order for Thursday, September 28th, Washoe County District Board of Health meeting. Secretary, would you call the roll, please?
Yes, sir. Kitty Jung is absent. Dr. Novak?
Here.
Oscar Delgado? Here. Dr. George Hess? Here. Christopher Dare? Here. Michael Brown?
Here.
Tom Young?
Here.
We have a quorum.
Thank you very much.
Thank you.
Commissioner Jung is at a county function, learning to do a lot of very important things for the county, so I am filling in today. Pledge of Allegiance, Dr. Hess, would you get us started?
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Madam Secretary, any public comment?
At this time, Vice Chair.
Okay, thank you. We're going to move on to approval for the agenda. Do we hear any comments, additions?
I
Yes.
have one comment. If you look at the very top, it says Chair Jung called the meeting. She wasn't here, so just to correct that. At the very top of it.
On the minutes. Yeah, we're on the approval of today's
Oh,
agenda
today,
and
I'm
stuff.
sorry.
You're just 1 second too far ahead.
Oh, sorry.
Make a motion to approve.
All in favor?
Aye.
Aye. Good. Now we'll go along to the recognitions. Mr. Health Secretary.
Thank you, Mr. Chair. We've got today several promotions, and so I'd like to start with congratulating Angela Penny, who's been promoted from public health nurse to public health nurse supervisor, so our newest supervisor in CCHS. And Angie, maybe if you could stand to be recognized, and I don't know if Mr. Cutts, if you wanted to make any comments.
Good afternoon, Mr. Chair, members of the Board of Health. Steve Cutts for the record. So yes, Angela Penny is our newest public health nurse supervisor in CCHS. She has worked in public health since 1993, starting out here at the Washoe County Health District. Left for a short time, actually did public health in Alaska, flying from village to village. Decided she liked the comforts of the Reno-Sparks area, moved back. She was rehired. Most recently, she has been a public health nurse assigned to a disease intervention specialist role in our sexual health program, and is now our public health nurse supervisor, and we're thrilled to have her as part of our management team.
Good, thank you.
Next, Stephanie Chen is not able to be with us today because the Nevada Public Health Association conference is going on, so she's over there. And Stephanie has been promoted from an intermittent hourly employee to a permanent health educator position within CCHS. She'd been working in the chronic disease program and will continue to work there now as a permanent employee. For years of service, we have recognition for Judy Medved-Gonzalez, who has 20 years of service with the health district as a public health nurse too. Judy's not able to be here today. We've got a busy day going on in the clinic. And then also I wanted to congratulate Sarah Bale for a new position that she took working under contract for the state of Nevada. You'll recall Sarah was our Director of Programs and Projects and was leading our strategic planning effort, community health improvement plan effort, and one that's very near and dear to Dr. Novak is our accreditation effort.
You bet.
And so I congratulate Sarah on her 15 years. She just did a fantastic job for the health district. And I'm pleased to report that I have filled that position and that new person will be beginning on Monday. And so we will continue the charge toward accreditation.
Terrific, thank you.
Thanks. Do we want to do a picture then with Angie?
we're glad to have you all right in the pen, so.
And we're gonna do 2 pictures here, please. Get tighter, Rich, please, thank you. A little bit more, thank you. Okay, we're gonna go on 3. 1, 2, 3. And one more. 1, 2, 3. Great, good.
Thank you.
Pretty sharp today, buddy.
Okay, Chris, now's the time to
Sorry
bring it.
about that.
No, it's all right.
I'm jumping out of order.
Have a request, that if you could announce who made the original motion and who seconded it on the items for Laura,
Oh, for the first part?
and moving forward, so.
Oh, okay, thank you. Okay. Did she get
I
this
don't
one?
think she got the one
Okay.
on the approval of the agenda,
Okay.
so if we could,
Back here on the approval of the agenda, Chief Brown brought the motion, Oscar Delgado brought the second. Moving right along, consent agenda. Now,
Yes, sorry about that.
no problem.
Am I on? There you go. Just at the very beginning, the top, it was a small typo, but we want to make sure they're correct. It says Chair Jung called the meeting, she wasn't here. You were-
I chaired it.
Yeah, so we just need to correct that. That would be my only correction to the minutes that I see.
Anything that needs to be pulled out of the consent agenda? Okay, hearing none, do I have a motion to accept it?
I move to accept.
Second.
Okay. Motion by Mr. Dare, second by Mr. Young. All in favor?
Aye.
Good, thank you. Lots of items on the consent agenda. Okay. Now, next thing we have is a presentation by Truckee Meadows Regional Planning Agency for their regional plan for 2017. Hi, Laura.
Thank you, Mr. Chair. For the record, I'm Lauren Knox, and I'm with the Truckee Meadows Regional Planning Agency. So some of you may already heard this information, or you may already know it, but really I'm here today to talk about who TMRPA is, what we do, and then touch on the 2017 Regional Plan Update, which we're pretty excited about. All right, so we'll start off with a quick video explaining who TMRPA is. TMRPA is the Truckee Meadows Regional Planning Agency, responsible for coordinating planning across Reno, Sparks, and Washoe County. TMRPA is made up of the Regional Planning Governing Board, the Regional Planning Commission, and agency staff. By promoting collaboration and addressing growth, the agency ensures efficient use of resources. To accomplish this, TMRPA develops and maintains the Truckee Meadows Regional Plan. The regional plan is built upon the agency's various technical analyses. For example, the consensus forecast, which is a 20-year look at population and employment growth. Here, the locations of population growth are shown in red and employment growth in yellow. In order to do this forecast, TMRPA tracks potential development. This flyover depicts areas mapped for future development. This allows for a comprehensive look at planned growth. Understanding development potential helps us to imagine different futures for our region, called scenarios. Here you can see a simulation of possible future development on currently vacant lots in Midtown and downtown Reno. Scenarios allow us to assess potential impacts and make informed decisions about growth. Visit plantruckymeadows.org to get involved. TMR. All right, so next slide, please. Thank you. As mentioned in the video, we were really designed to foster coordination around the use of land and regional issues of concern, such as air quality, water, and infrastructure. And we do this across Washoe County with an emphasis on the more heavily populated portion of the region. And how do we do that? Well, we develop and maintain the comprehensive regional plan, which basically coordinates growth across our region and has a 20-year horizon. So all in all, we promote collaboration and address growth at a regional level. So why plan regionally? Well, because the impacts of growth know no boundaries. So take me, for example, I live in Sparks, I work in Reno, and I play in Washoe County. But the need for resources, such as roads, water pipes, and schools, really transcend jurisdictional lines. So who do we coordinate with? We have a variety of regional partners, including the Washoe County Health District. And our data and analyses have been used by various groups, such as the Economic Development Authority of Western Nevada and the Western Regional Water Commission. In fact, since 2012, we have completed 40 collaborative projects, leveraging more than $1 million from regional partners and really maximizing the investment of government dollars. So why am I here today? We've recently launched the public participation phase of the 2017 Regional Plan Update. So this is a required 5-year update, and really the last major update that we did was in 2007, so that's about 10 years ago. Our community's really changed a lot in terms of economy, demographics, land uses. We've seen a lot of change. We expect to see more, and we really want to be prepared for that. So since the regional plan addresses topics such as population, conservation, and infrastructure, this is really the perfect opportunity to engage and really share your thoughts about the future of our community. So there are various ways to engage with us on this process. You can visit our website, which is plantruckymeadows.org. On that website, you'll find a link to our survey, which takes about 5 minutes. It's pretty interactive. We also have a subscription link to stay updated with newsletters and get a little bit more information and more detail on the process at that website. We really appreciate that your staff has already put this information on your website and put it out through social media. So we're really just trying to engage as many people as we can. I thank you for the opportunity to talk to you today, and I can answer any questions if you have any.
Do you have any questions?
I have one question.
Go ahead.
So when it comes to this, you guys are going out 20 years. Right now, all the projections I see are pretty crazy, actually. And so you look at that, and it makes you have a lot of questions of things. Do you guys ever tie it to any of the infrastructure needs of what's there and make that available? I've seen your presentation a few times now, and I don't know that I've heard how this tool can be used in that manner, but I do think that would be a pretty important thing for us to look at.
Absolutely. So one of the things that we do is the consensus forecast. So that's really a population projection for the whole region. And one of our requirements is that every jurisdiction that's planning for infrastructure or any other needs uses that same population projection so that everyone's really on the same page in terms of what our needs are going to be in the future and kind of what we have now. We also have some infrastructure requirements in terms of policies, and those really get disseminated through the master plans and facilities plans of the local jurisdictions as well as any regional entity providing services.
So do you have something on here, if I were to go on here, that I could look at, and it'd be a tool that I could say, okay, in 5 years, you know, when I think of infrastructure, I guess that's a terminology that's thrown around a lot, but you're thinking even first responders, or you're thinking even sewage. I mean, all the different things. I know what we're doing sewage-wise, but that's the idea.
Yeah.
Is there anything on here? There's a tool on here?
So we don't have that quite yet. That is definitely something we've been talking about with the update. We want to have that kind of information. We want to make it easier for everyone else. These online platforms are something that is very helpful in helping people understand kind of our needs. So we are talking about that piece, and we think it would be great to include something like that.
Because I'd encourage you that would seem to be the piece of this that actually would make me very excited about the work you've done. And not that it's not good, and that's a nice video, but that part would be important. Thank you.
Thanks.
If we go to this website, you'll have that information for 5, 10, 15 years down the road.
There's, in terms of for the future, having that information?
We're going to change the population and then secondary, what we'll need in infrastructure.
Yeah, so we'll have the population stuff. We have some information and some studies done, for example, an industrial land needs analysis or a housing needs analysis, but in terms of the specific infrastructure pieces, we don't have that quite as dialed down, but it's something we want to do in this update, absolutely.
Any other questions? If not, Lauren, thank you very much.
Can I just make a
Oh,
comment?
sure, please.
I would just urge the board members to go and take the interactive survey, mostly because it's just really cool. The survey tool that TMR PA is using is different than what I've seen before, and it's pretty neat to check out. But then also, of course, it's great for them to get your input. So.
Thank you.
And we have that address right here. Thank you very much.
Thank you so much.
Okay, next item on the agenda is Emergency Medical Services Authority.
Good afternoon, Mr. Chair, members of the board. J.W. Hodge with REMSA for the record. You've been provided our August report. I'm here to answer any questions you may have about that.
Do we have any questions? If not, do I hear a motion to accept the report?
Motion to accept?
I'll second that, but I first also want to welcome you.
Oh, thank you.
This is his new, he's stepping up into this seat, so awesome seeing you out there.
Thank you very much.
Good, thank you. Okay, first by Mr. Brown, Chief Brown, and second by Mr. Dyer. All in favor?
Aye.
Good, thank you. Now we're moving on to item 9, presentation.
8B.
AB.
Oh, I'm sorry. Mr. Romero.
Good afternoon, Mr.
I'm
Chair,
used-
members of the
I'm used
board.
to you doing the A report, so.
Thank you. We're obviously nearing the end of our busiest months this year. I wanted to give you all a quick little update on things. July 30th to August 2nd, we teamed up with the Truckee Meadows Fire Protection District to provide 2 medical aid stations, 2 response units, and an on-site manager at the PGA Barracuda Championship. On August 7th through 13th, we added additional medical staff and provided EMS at 8 different venue sites for the Hot August Nights event. On August 25th to September 5th, REMSA supplemented the Gerlach Fire Department with an ALS ambulance for 10 days during the Burning Man event. We worked with County Emergency Manager Aaron Kinnison and Richard Walsh at Gerlach Fire Department to increase their level of service during that time when they had the population density increase for Burning Man. Simultaneously, we work with the City of Sparks Fire Department and the Sparks Nugget to provide EMS at what ended up being a very busy rib cook-off. We also did the National Championship air races, and that was staffed with a medical clinic jointly by REMSA and St. Mary's Regional Medical Center. We had multiple medical response units, 2 ambulances dedicated to crash fire rescue with the Reno Fire Department, and we also repositioned Care Flight up there for that particular event. We're now beginning operations for the Street Vibrations event, which includes additional staffing to the system and with law enforcement. This is very widespread, different than other events because we have so many people on the roads, different areas of the community. Again, all this is done to really minimize the impacts of the everyday normal 911 system. We want to make sure there's no impact on our normal operation when an event like this is taking place. REMSA tactical paramedics also work with the White House Advance Team, Secret Service, and local law enforcement during the President's visit to our region. And we took place in 2 hospital exercises in the past month. And finally, ending, I'm pleased to announce that our Wingfield and Spanish Springs unit will switch to 24-hour coverage beginning October 15th. Previously, this station was staffed 16 hours a day, and we noticed it was a reason to increase to 24-hour coverage.
Good.
I'll answer any questions you may have.
Any questions? Okay, it's not an action item. Thank you
I
very
have
much. Yeah, go
I have a
ahead.
question. What is a penalty fund? I don't know that I've ever, it's at the very end of your report. It says penalty funds.
Yeah, since that's part of the franchise report, I'll let Mr. Hodge answer that.
I don't know that I've seen that before, I just don't know what that is.
Thank you, JW Hodge, for the record. The penalty fund is the fund, anytime we're late, we get fined per minute that we're late. That goes into a fund, and then it's used jointly with the Washoe County Health District to fund community projects or anything that Mr. Dick approves.
Gotcha.
And then we report back what we spend that on each month to you.
Thank you.
You want to comment on that? No?
Okay, good, thank you. Any other questions? This is not an action item, so we'll move right along. Discussion of the process and presentation of evaluation forms for the district health officer annual review and possible direction to the staff. Let's see. Lori, you want to do a presentation on this for us, please? You want to fill mine out?
Lori Griffey, the health HR rep for the health department. This is just an annual process we go through to do an evaluation for the district health officer. It's the same questions we used last year, which were the same ones that were used for the county manager. And I just need your approval to go ahead and start the evaluation. It's done on a 360 evaluation where we send it out to the list of people that is in the packet. Everybody puts their input in, and then next month I'll bring you a consolidated presentation with all the results, so you can give him his evaluation.
What's the deadline for us to get this completed?
We're looking at like the 17th
Okay,
of October, so you have a couple weeks.
good, thank you. Any questions? Comments? Okay. Do I have a motion to accept this and move forward? Okay,
Second.
okay. Motion by Dr. Hess, seconded by Chief Brown. All in favor? Aye. Good. Thank you very much for
Thank
your
you.
work. And board members, look at your emails. It will be coming to you soon. And it doesn't take too much work to get it done, so. Okay, I guess we're down to the staff reports. Ms. Albee.
Charlene Albee for the record, Director of Air Quality Management Division. I don't have any updates at this point, but I'm available for any questions you might have.
Do you want to make a comment about your meeting?
I can make a comment about my meeting.
A nice one.
Yes, it's a nice comment. I was in Seattle from Sunday till last night at the National Association of Clean Air Agencies meeting. It's all of the air directors from states and locals across the country. We represent about 40 states and 116 locals. We had a very good meeting, talked a lot about national and regional updates, events that are going on. I actually chaired one of the panels on wildfire smoke, and it was amazing the amount of information that the Midwestern states are now actually starting to pay attention to. Since we had all the major fires in the West this year, they were big enough they actually affected Kansas and Illinois and Michigan and places that have really not had problems with those in the past. So they're now looking to us to get some direction. One of the items on the agenda was the donation, on our consent agenda, was the donation of monitoring equipment. Apparently, the locals in South Florida have expressed an interest in that. So NACA will be setting up basically a here's what we have page so that they can start hooking up the needs with the available resources. So that's going to be something that I think will help out on a national basis. We did have the opportunity to meet one of the new administration representatives who works with the congressional office, and I believe that we were able to provide him an education on what our needs are, and he will take that back to Washington, we hope, and we'll continue on. We did have very good conversation with our EPA staff members, the head of the Office of Air Quality Planning and Standards and Enforcement, and so it was a very good meeting. I guess I should add, full disclosure, I've been on the board for a year now, and I was just elected to the executive branch. So I'll be treasurer for the next year, and then that leads into a succession of vice president and then president. So,
Congratulations.
Yeah.
so that's what we have going on.
One kind of unrelated but question. Does FEMA have portable equipment to go in right off the bat, right after one of these natural disasters like Texas, Florida, Puerto Rico, to start monitoring the air?
No, they don't. They depend on EPA to bring that in.
Okay. But there is portable units?
There is equipment available. The regional offices each have that equipment, so it's just getting it into where
In a
it needs
position.
to be. I believe that they had a significant lesson on 9/11, and they were late in getting the equipment deployed into New York, and they have learned from that and are
Good.
now responding much more
Good.
quickly.
Thank you. Heather?
Is there any status change on our state, all that stuff we chatted about, when it came to, I forget the exact terminology?
Our ozone designation?
Yeah, yeah.
We have heard, with the concurrence on our exceptional events demonstration, that Washoe County is expected to be designated as attainment. We have found out the process that the EPA is going to use is each of the regional offices will be taking action. So ours will be out of Region 9 on a state-by-state basis. So they are going to send one letter to the state of Nevada. At this point in time, there's some areas of Clark County that the recommendation that they made for attainment is not really being agreed upon, but they think that they can get the 2016 data in there and be considered, and that may sway it. So we're expecting to hear a letter or see a letter that identifies everywhere in the state of Nevada except this one area to be in attainment. They will not take final action until they get through that state where or that issue that they have down in Clark County. But we will be recognized as attainment.
Good.
Good.
Good job. You guys did a lot of
That's
work
a
on
tough
that.
one.
Truncation is honestly the only way we got there. And so we have an awful lot of work to do. Along those lines, at this meeting, I did meet with South Coast Air Quality and several of our sister agencies in California, and they've got some initiatives. We signed on to a petition last year for low NOx, ultra low NOx emission standards for heavy-duty diesel trucks because we have so much trucking that comes in and out. And their newest topic is locomotives. So they're actually asking for some letters of support for locomotives, and having the Sparks train yard, that would provide us some significant benefit also. So I'm hoping to be able to respond, have an update for you next month on that. But all of these things in line with our ozone advances, the only way we're going to stay and get a little bit of a buffer on that standard.
Thank you.
Thank you so much. I know this is a lot of work, and I appreciate you being on top of lots of things, so.
You're welcome.
Thank you. Next is our report from the Community and Clinical Health, Mr. Kuntz.
Again, Steve Cutts for the record. I have nothing further to add, but would be happy to answer any questions you may have.
Any questions? Yes?
Thank you, Chair. Question on page 5 of 11. We have this is a little alarming. If you can share with me a little bit more, maybe this can also, Mr. Dick. It says here that the greatest number of fetal and infant deaths occurred in 89502 in the zip code. That's increased from fiscal year 2016 from 19% to currently in fiscal year 17 to 32%. That's pretty alarming. What are we doing to jump in front of that? And also, Mr. Dick, if you could talk to us about, I know Chucky Meadows Healthy Communities has took on the initiative early on to make better and bigger impacts in 9502, and if you can speak to that as well, because I know we spent quite a bit of time and resources in terms of working with them.
Sure. In answer to your question, what the data was showing is that young women early in the pregnancy were not seeking out prenatal care. So we've been working with the group here in Washoe County, our FEMA team, to start the Go Before You Show campaign. So encouraging young women to seek out prenatal care before they're showing basically in their pregnancy, because then they have the best possible outcome for their pregnancy. Specific to the 89502, I would have to get more information from the program team as to why there was the specific increase in 89502. So I can report on that in next month's report, if you would like. And then I will let Mr. Dick speak to the 89502.
Yes.
Thank you.
Thank you. Truckee Meadows Healthy Communities has focused a number of resources around family health festivals that we've been holding primarily in the 89502 zip code area. We had one recently in June where we were moved outside of that area. But in those family health festivals, we are providing assistance with getting people enrolled in for Medicaid and the Silver State Exchange insurance programs. So facilitating that that pathway for access to healthcare services, as well as providing a number of other services there. We haven't delivered specifically any services targeted specifically to pregnant mothers and the first trimester, but I think that that's an opportunity for us in the future with this the new Go Before You Show campaign to be distributing those materials in that community.
Yeah, I'd be really interested to see what we're able to do. That's almost double the number, right?
Sure.
Almost double. Here in our urban core, we have, of course, we currently, I believe, if not just outside of the border of 89502, but we also have our regional hospital in 89502.
Yes.
We've known for a number of years now that this zip code has, we're constantly trying to battle against some of these health concerns in general. And we've made commitments across the community in terms of making those impacts and moving that needle. Here in 89502, it's not only the infant and fetal deaths, but it's other issues, as we know, from obesity and diabetes and so forth. So I'd be really interested to see what we've done also, Mr. Dick, from the amount of resources we put into the Truckee Meadows Healthy Communities perspective as to what are we doing in terms of moving the needle related to healthcare. I know Truckee Meadows Healthy Communities has done a few different things and have led the charge in different ways of maybe housing and so forth, but I don't want us to lose the focus in terms of what our resources are, and that's directly impacting the health, the overall health of our community. And that falls in line with housing, but we are first and foremost a health district in terms of what services we could provide to them and in alignment with the other housing folks in our community. But that was alarming. Just wanted to highlight that. Especially biasly, that I'm a representative for Ward 3, and that heavily by far is 89502.
Absolutely. And just a couple other things I'd like to mention with relation to FEMR. Washoe County Health District staff, myself included, are part of the statewide Safe Sleep Work Group. A large function of that is to promote safe sleep activities. I believe I played a commercial for you. I know we've had some technical difficulties in the past. I can't remember if that was the one where we didn't have sound or not. So there have been radio and TV spots statewide over the past number of months. Also, we promote and distribute working with REMSA pack and plays. So as part of the Cribs for Kids campaign, encouraging parents to not co-sleep. There are a large number of people across the U.S. that believe in that and support that and encourage that. We, from a public health standpoint and from Human Services, we partner with Washoe County Human Services Agency, work to dispel that myth and encourage safe sleep, which is alone on their back in their crib. And crib can be in the parents' room. We very much encourage that. We work with the local hospitals. They distribute sleep sacks. So now the recommendation is no longer to have bumper pads in the crib, blankets, comforters, et cetera. It's a sleep sack or a onesie, so that there's nothing to get tangled up in, nothing to bury their face in against and have a infant death. Gotcha. So there are a number of activities going on, but I will get more information for you specifically regarding 89502 for next month's report.
Yeah, I mean, just generally speaking, just the increases in numbers. I know we put a lot of resources, a lot of information out there to just generally speaking. And we've put in a lot of resources, but this one just jumped out. I mean, almost doubling in terms over a quarter, right? Was in with one zip code, and in addition to that, I know the community, generally speaking, it's a large percentage Spanish-speaking Latino community. So what are we doing from that standpoint?
Everything is bilingual, so it's both in English and Spanish. Both our handouts, the commercials on TV and on radio.
Cool. Thank you, Mr. Cox.
And within the hospitals too, all of their materials regarding safe sleep are bilingual.
Awesome. Thank you.
You bet.
Okay,
Any other questions? Sorry.
Yeah, Mr. Cutts reminded me with that. I just wanted to also note that we did at the Family Health Festivals have the Cribs for Kids program table set up and those pack and plays. So that was one of the services that was delivered there. I guess I would also note that, it certainly is concerning to see that increase in the 89502 zip code area when you are looking at an N of 78 total cases in the community. With a total population like that, you might see some pretty significant changes from year to year as to where those cases are occurring. But certainly it's worthwhile noting that significant increase we see in 89502.
Well, I know, Mr. Dick, I know the amount of work you're doing with Truckee Meadows Healthy Communities as well, and just want to make sure we're getting a good return on investment in terms of how much time and dedication and funds and resources we're providing there, that we're getting something in return. We don't lose our focus. Thank you, Mr. Cutts. Appreciate it.
Thank you.
Thank you, Mr. Dick.
I have a quick question.
Yeah, go ahead.
So what is a fetal anomaly? I mean, that actually quite a raise as well. What would be considered an anomaly? It seems like that's a other.
Could be something, heart defect, heart and lung, so organ systemic problems with the fetus.
So we had quite an increase this year on those, if you look at your thing here.
And it could be from a number of things. It could be congenital defect. It could be an exposure to substances, substance use and abuse. So there are a number of things that can cause fetal anomalies.
One thing that I think would be interesting to watch is to see if that continues to rise with the continued drug use, and because that's what I thought it might be.
Yes,
So,
and
yeah.
oh, I'm sorry. Go ahead.
No, it says drug use, fetal alcohol syndrome, all those portions.
Right, and I just wanted to remind the board that we're very new to doing this. This is our second full year of our fetal infant mortality review program. So we don't have a lot of historical data or information or trends at this point. We do partner up with other jurisdictions that have fetal infant mortality programs. We're also the first in the state of Nevada to do this, so we're pretty proud of that. But we'll see if we can bring that all together, get some more information regarding 89502, anything that they're seeing regarding trends thus far, or anything that may be happening in other communities, and we can bring that back to the board.
I would be interested, just given what our culture is shifting to with marijuana and different things, is to watch that one and maybe make sure that it might be better. I know this is an anomaly, but it might be better to kind of have a little bit of idea if it's possible to ever get a breakdown. Because anomaly, if it means more than that, or is it pretty much directed at that? That's kind of why I'm asking that. Can we look at that and say, well, that's probably directly?
Oh, if it's directly related to substance use abuse?
Is there any way to put that as part of this chart so we can kind of watch that in years to come as our society decides to open more pot shops? It might be good to see the direct results.
I would have to look into getting more information on how the anomalies are reported out. I would suspect that what we could easily report out on is maternal, and it would either be self-reported and or backed up with lab reporting, but substances in the mothers.
Yeah, thank you.
Good. Any other comments, questions? Thank you, sir.
All right, thank you.
Okay, moving around to environmental health services, Mr. Dick.
Thank you, Dr. Novak. Just a couple of things to point out in the food program. We're continuing to work to provide education to the public and to food establishment, as well as tools for them on the issue of service animals versus therapy dogs and emotional support animals. So I think that everyone that gets out and about recognizes that we do have some issues going on in our community with animals being in places they're not supposed to be when they're not service animals. So we're continuing to work along those lines. We had the last helicopter application for larviciding that occurred last week on the 20th and 21st. We're pleased to see the cooler temperatures, which will slow down that activity. But I'll let Dr. Todd report for us on where we're at with the West Nile virus activity. On waste management, I just wanted to inform the board of, under the new Washoe County franchise agreement with Waste Management, that new agreement allows Waste Management to terminate garbage service for customers that are delinquent in their payment for that service. And so that's a new thing in the new agreement. And there were letters that were sent out today to residential customers that are delinquent in their payments that their service is going to be cut off. So I don't know if you'll see anything about that in the news. The health districts, our regulations require that the residents has their garbage disposed of within 7 days, but we do not require that they have garbage service. We do for the facilities that we permit require that garbage service, but it's not part of our regulations to require the garbage service. That's part of the Washoe County franchise agreement, and it's out of our area of authority. So I just wanted to provide that background information for you to see or hear anything in regard to that.
Mr. Dick, is that countywide, or because I know the city of Sparks and Reno have separate contracts with Waste Management?
Yeah, thank you for that clarifying question. This is the unincorporated area of Washoe County specifically. So Reno, as you point out, has a separate franchise agreement. Sparks has a separate franchise agreement. This is for those customers that are covered by the Washoe County franchise agreement.
Okay.
Any other questions? I've got one. If we run into an individual that doesn't want to dispose of the trash, have a contract, who is going to make sure that this is done and it's picked up in a week or 2 weeks or whatever, and not just piling in the front of the house?
So since we have the regulation that says that it needs to be disposed of within 7 days, we will be responding to complaints of if we find that they are violating our regulations, we'll require that they have the garbage removed, and we'll follow up to make sure that it is.
Okay. Citations or?
So yeah, we will have an open complaint usually, and a date that we're going to come back and check on them to make sure that they've got it resolved.
Will that be a
But it's-
citable offense?
We can cite people for that.
Okay. Good. Okay. Nothing else? Dr. Todd? Epidemiology and public health preparedness.
Good afternoon, Randall Todd for the record. I have a few updates from my prepared and written report. We'll start off with West Nile virus. Mr. Dick updated you on certain aspects of that. My report talked about 12 human cases so far this year. I now have 21 cases that have been officially reported to us so far this year. And like Mr. Dick, I am pleased that the weather is cooling off, and once we have some hard freezes, hopefully the mosquito activity will slow down considerably and we'll stop seeing more of these cases. At 21, this is the highest number of West Nile cases we have ever had in Washoe County. I think the previous high was 17 cases, and I think that was back in 2006. So in most years, we'll have anywhere from 0 to 2 cases of West Nile virus. And so this year with 21, that's a pretty significant occurrence. I also wanted to update, my written report had talked about 12 cases of coccidioidomycosis or valley fever. That number is now up to 17, which is also a record for us here in Washoe County. The previous record was 9 cases back in 2015, and a number of these cases appear not to have any exposures outside of Washoe County. If you look at the Cocci map of the United States, you know, the biggest number of cases are in the Arizona area, but that comes on over into southern Nevada and comes a bit north. However, those maps were produced back in the 40s and 50s, and we think that this organism has changed its habitat perhaps a little bit. We know that a new habitat was discovered just a few years ago up in the state of Washington. That's way further north than what we had ever experienced before. And so we think it may also be moving further north within Nevada. I think I reported previously that we had done some field testing with environmental health and with the CDC. We're still awaiting those lab results, so we don't know whether we can actually confirm that we had the organism in any of our soil. And then, last but not least, we have been, we are planning this fall to do a number of points of dispensing for influenza vaccine. Most of these will be private pods that we are assisting some of our partners to put on. However, there will be a public pod here at the county on October the 4th. We are planning for up to about 400 participants. So if any of you would like to come by and take a look at that, it'll be in the afternoon, I believe starting around 2 o'clock, 2:30 on October the 4th. And with that, I would entertain any questions that you might have.
Any questions? How is the public going to find out about this pod on the 4th here?
Well, we're not doing a lot of advertising on it because we're a little bit concerned that we might get considerably more than 400 people showing up. There is the RAM event that is happening just before that, and so we will be handing out flyers and wristbands, and then we've been reaching out to certain other groups and providing them with wristbands so that they can be assured of getting a shot if they come.
Okay. Mr. Delgado, is this something that the 502 zip code is going to know about, should know about? This is an issue in a lower economic groups that could be very significant to us in the long run.
Right, I'm assuming your guys' overall campaign is going to reach out to the general community, and I think when Mr. Cutts comes back, there'll be a little bit more specific direction in terms of how you guys reach out to certain communities. I'm assuming in terms of we see issues like in 89502, the Spanish-speaking community and so forth, when you guys reach out to the media, radio and so forth, and not just a general English press release.
Yes, and you know, with that, the reason I hedge a little bit on how much outreach we're doing on this October 4 event is because we have a limited amount of vaccine. That's the primary thing that's limiting us on this one.
Yeah, I know availability to our general community, everybody and their brother has it for $15 or insurance copay, but this is one that is a very kind of a unique situation to come up and get a large number of people that may not be able to access it any other way. So.
Correct.
One other question. Is the CDC doing a new mapping on Cocci?
You know, that's a good question. They did revise the map slightly when they identified the little pocket up in the state of Washington. But they tell me that they, although they could do this kind of mapping back in the 40s and 50s, there is some reason that I don't totally understand that they can't really do it now. And so we're sort of limited a bit. Now, it would seem to me that if they actually find this in our environment locally, that they could redraw the map a little bit, much like they did in Washington State. But whether they will or not, I just don't know.
Is this one of the reportable diseases of the CDC?
It is a reportable disease.
Okay. I think, don't understand the, why they're not, because that, to me, should be coming from that reportables.
Yeah,
But,
at least
okay.
it is reportable in Nevada and some of the other western states. It may not be a reportable illness back east because they tend not to have this back there.
Good, thank you. Okay, got Mr. Health Officer.
Thank you, Dr. Novak. I continue to work with TMWA and NDEP and with the jurisdictions to try to find approaches to streamline the water project submittal and approval process. And I included some attachments to my report. We had a meeting with the Associated General Contractors on September 20th, and we provided them with this information regarding the requirements or issues that we have resolved to streamline the review. Some of those being we're not looking at any irrigation systems supplied by potable water that are 2 inches or less in diameter. We've resolved issues that we were running into with private fire hydrants versus public TMWA maintained fire hydrants. We were receiving plans from TMWA that did not provide on the plans any easement for the mains being in a public right-of-way. And we've been able to work with them and with NDEP to be able to have a generic statement on the plans and have the easement information provided through the construction completion letter that we receive on those, so nothing gets held up earlier in the process. We're only reviewing to NAC and not looking for conformance with the TMWA design standards. And we also provided more guidance on when a water project submittal is required. There was a misconception in the community that we were requiring water project submittals on all projects, and we worked with TMWA staff and we identified the minority of the projects that actually need a water project, and that's what's outlined in the table, the plan submittal, the next page, plan submittal guidance for TMWA service territory only. It looks like a lot of information, but we're basically trying to cover all the different scenarios for somebody that's got a project. And this, when you look and see in the required information of Washoe County Health District, the water project submittal is limited to just a few categories of projects on here. What we found actually as we were working with the jurisdictions was that there was some misinformation that was happening about projects and the health district holding them up. And for instance, there was one in Sparks that I heard from the city manager about where the claim was that we had held it up for a project over a fire hydrant being relocated, and in fact we had done no such thing. And so it actually provided an opportunity for us to dig into that, provide information back to them, and for them to understand this was not a health district issue. It was interesting that when we met with the Associated General Contractors, one of the complaints that they had was of being out in the field and starting construction on the project, and now Health and NDEP are holding it up because they dig in the ground and they find the pipe isn't where they thought it was going to be on the plans. In reality, we're not even involved in those situations. That's between TMWA's project engineer and their construction job and how that, and engineer and how that gets accommodated in the field. And it's only very rarely that we would be contacted by TMWA if they didn't have a resolution to how they were going to approach that problem. So we're continuing to work on this. I've got communication to Don Tatro at Band to see if we can get a meeting set up to meet with more of the design engineering community as well to relay this information. Back to that, the September 19th document on our letterhead, the water project plan review, we also tried to emphasize to the AGC group that we met with some of the things that remain in NAC that need to be complied with, that they really need to be paying attention to with the plans that they're submitting, so that if they are doing these things that NAC requires, then it's easier for us to move the plan forward. The other piece that we've discovered is that we have many projects where they are not working with TMWA early on in the project. And TMWA needs to first determine if they have sufficient water for the project, or if they need to provide water rights for a project to proceed. They then need to identify what capacity requirements that they have in the system, and that affects the sizing of the piping and the design. And then they need to develop a design and have TMWA review that to make sure that it's a design that TMWA is satisfied with, and then it comes to us to take a look at. And that process can take quite a while. And yet we have projects that are hitting the building counter at one of the jurisdictions, and they have not yet gone to TMWA. If we need a water project on it, then we send them a comment that says, hey, we need a water project submittal. We may not get that water project submittal for a month or two after we submit that comment to them. They're counting us holding up the project from the day it hit the permit counter at the jurisdiction. And so that's why we put together these flow diagrams that we distributed to try to show them what's happening that we're seeing in the current system with the submittals, and what we see as an ideal submittal flow if they start engaging TMWA earlier in the process. The discussion with NDEP has been around some of the specific requirements that are in NAC for those separation distances. Some of the things that we listed that the developers need to be paying attention to with the plans that they're submitting, and whether there's an ability to provide some additional accommodation and flexibility in those without jeopardizing public health protection. The other discussion that we're having is for larger water systems like TMWA and like the Las Vegas Valley Water Authority, whether it makes sense to have a different oversight approach than the health district looking at each of the water project plans that are coming in. And so NDEP has indicated they're willing to explore that. And so I think that's positive, and we'll continue in that dialogue with NDEP and TMWA and engaging the development community if there are opportunities where you can make some changes to NAC that make sense for how we're approaching development. The regulations go back to 1997, and we've got a lot of new pipe materials that are being used now, a lot of advances that have occurred since then, and so I think it's justified for the state to relook what they're doing with the NAC. So that's kind of my summary. I'm sorry to take a lot of time on that, but I wanted to get you kind of up to speed with where we're at.
It's important. Maybe get us out of the middle.
Well, we're continuing to I think we're going to kind of stay in the middle because we're assigned that role by the law. And I've been questioned, why is the health district doing this? We've had TMWA for all these years. We don't have a problem with our water quality. It's unnecessary. It's just an impediment. And I explain to people that I have several responsibilities, not just one. One of my responsibilities is to protect public health, but another one of my responsibilities is to comply with the law. And so legally, we're required to do this. And so I may not be able to get out of the middle of it, but we're certainly trying to make things work as best they can under the regulatory scheme that's established by the state.
Good. Yes, sir.
I have a few questions, and thank you. I know you've been working on this, and I know it's taken probably more time than you'd like to give to it at this point. A couple questions. One, how do you feel that TMWA is accepting the conversation with the design problem that it's coming incomplete to you. Did they understand that? Was that something that
You
needs
know-
follow-up, or is that something that is, they saw it and they're like, oh,
Yeah, I think, one of the positive things that's come out of this is I think we've got better communication going on
Good.
between Tumwa staff and our staff. And I've been meeting with Mark Forey more frequently than I ever did before, and I think that's good. So I think that we're actually seeing improvement in plans that are coming through. And when we do have problems with plans, what I'm also seeing, I believe, is more attention from Tumwa's part about, well, what was the problem with the plan and how did this happen, so that they can look also at their process and if there's a way of improving that. I would also add, though, one of the consequences that we have with an exploding development environment is that there are just a limited number of resources, not just within the regulatory side of resources, but within the engineering design community. And so I think part of what's going on too is we have engineering firms that are just overwhelmed with the workload and all of the projects that people want to move forward and are juggling numerous projects. And so it may take longer for them to get a plan developed, or if there's a comment on a plan, it may take them longer to be able to get the revisions back to us because they're juggling so much work that they're doing right now.
I have a couple more. Another thing, we talked a little bit about the idea of possibly getting plans in where they would not just go to one group and then the other. Is that congruency happening? Is that a conversation?
There was a meeting yesterday afternoon, and we're starting that process with a concurrent review on a pilot basis to see how we do with that. And I'll tell you, I'm a little uncertain what the results. We're trying it. I guess I have maybe a greater confidence of how it will work on a second revision coming in than a first one, but we're going to try it both ways and see how that works.
And then my final question is, with all that you just mentioned, in the perfect world, obviously, that there's more to it, do we need to look at the idea, do we have what we need inside of our mechanism for health, given what's been asked of you to have? Do we have the proper planning group in there? Do we have the proper amount of staff in there? With this growth, there's obviously different gears. We're one of the gears that functions, and we want to make sure that gear is turning to the best. It doesn't have to be faster than it should be, but at least turning at the right speed. And if we don't have enough staff in there, obviously it's going to go slower than everything else or whatever. So what would be your evaluation of that?
Yeah, I guess my evaluation is I think that we're okay on our staffing level now. It's certainly something that we're watching. What we know that would improve this is if we had a better workflow process designed in the Acela system. And so one of the factors that's at play with the health district working on plan review with the jurisdictions is we're one entity that has to interface with 3 different jurisdictions in that plan review process. And so, for instance, a plan comes into the permit counter at the city of Sparks, and all of the different departments that are involved in the review are all within Sparks and under control of that workflow. And then it comes to us as a separate agency. And then the same with Reno and Washoe County. We actually have a quote in from a professional services firm with Acela on developing some better workflow for us that what we're calling a sub-process that could be the same sub-process attached to the Acela workflows of each of the agencies, because one or each of the jurisdictions, if one jurisdiction changes anything in their workflow, that now we have to learn something different that's going on in that jurisdiction's workflow versus the other one. So we're trying to get to a good uniform process that we can put into that system, and then also improved reporting so that we can optimize the way we're tracking the review that's going on, the people that are engaged, the timelines that they're hitting to stay on top of that process.
Thank you, I appreciate that.
I just have one question here, too. First, it appears to me that the delays are more in Tumwa than the county at this point, since you guys get this at the end of the stream. But I do think these discussions are going to help a lot to streamline the process for everybody, and also some education to see how this works and how we might do it better. But in Las Vegas, do they run with a similar submittal flow that we do up here, too?
So that's an interesting question, because part of the discussion that we've had with NDP has been that, why is the health district looking at these water projects when in southern Nevada the health district isn't looking at the water projects? And so the reason is because it says in NAC that we're supposed to be reviewing the water projects. And the question has become then, why isn't that happening in southern Nevada? So I think, you know, there's the argument that, yeah, they're not doing it in southern Nevada, so why are you doing it here? But that's the reason that we're doing it here, and I think NDP is trying to dig into why it's not happening that way in southern Nevada. I think, though, that also may be something that helps maybe to fuel this look at an alternative oversight approach for those larger water systems.
Yeah. Well, I do applaud you for, you know, like, us following the rules as we should up here, but at the same time, I really think this is going to turn into a lot more simple process for everybody, and I think it's great work so far.
Yeah, and I would just follow up too that while some of the delays may be happening at Tumwa, you know, I think that's because they're also working to provide for a good water distribution system that's protective of public health, and so. You know, I think we're all part of the process, and we're working together, and I think we're all working to try to make it work as best that it can while still doing the jobs that we're supposed to do.
Any other comments? Okay, good. We're on to number 11.
I think I wanted to
you got
highlight
more?
just,
Okay.
yeah, I'm sorry. I kind of got too focused on that one area. I did want to also point out on the community health needs assessment, we had a meeting on September 8th where we had 80 different community partners come in and help us to identify what they felt were the most important areas for us to work as a community together to address that are health needs in our community. And so I included the attachment for that. I was pretty excited actually about the event and how it turned out. Heather Kerwin of our staff just did an amazing job with the presentation on the community health needs assessment, where we're at to date, and facilitating that process. We had each of the people received 5 dots that they could identify what they felt was the most important thing for us to address. And the way we did this is we looked at these, the 12 health topics that you see ranked here. And under each of those health topic areas, we identified what are focus areas for initiatives that we could address under the health topic that had some data that we could use to measure progress and evaluate our impact through the community health improvement plan that we want to develop from this. And so we use the dots to vote on those sub areas that might be most important, and then the summary table that gives you the ranking rolls up all of the votes or dots that were put on each of those sub areas. And so social determinants rose to the top, and housing was actually the subtopic area that garnered the most votes of any of them. And you know, I think it's interesting that 3 years ago, when we were going through our prioritization process, I don't think housing would have been at the top of people's minds about what we needed to work around as a community. Mental health came in as number 2, access to health as number 3, and substance use is number 4 in this group, largely driven by the people's interest in working on prescription drug abuse. So it was interesting results. As Heather explained at the meeting, we also have the results of what the survey that we implemented for the community, what that identified as the priority needs. And then as the latest data comes out, we're adding it to the community health needs assessment, and we have an algorithm that we have developed to score what's the highest priority based on the data that we're compiling. And those priorities actually change on a weekly basis about right now as we get new data in that's coming out, because we're trying to get the most current data. We hope to have the community health needs assessment wrapped up by mid-December or so. So I just wanted to share that with you. And then the RAM event is going to be occurring beginning tomorrow morning.
Define that for everybody.
At 6 o'clock. The remote area medical free clinic services that are provided by volunteers, but using equipment and methodology that remote area medical brings in. So the truck is actually here today. It's over at the Boys and Girls Club. I understand it's humongous, 2-story sort of truck full of stuff that people are unloading right now, and should have everything set up by about 5. And then beginning at midnight tonight, we're using the county complex parking lot, and people will arrive here and they'll be assigned a number, and we'll have a certain number of people that we can help based on the number of volunteers that we have providing the services. Dental and vision being two of the focus areas for RAM, but other medical services as well, and vaccinations. And then RTC is partnering with us, and they're providing shuttle service from here to the Boys and Girls Club. They are a little constrained on parking, and so that's why we're using the complex here for doing that staging. And then we'll have some additional services, kind of a mini family health festival that we're going to provide over at the Health District tomorrow from 9 to 1. But there's going to be a media tent, which will be operational from 5 to 9 tomorrow morning. So Mr. Ulibarri asked me to invite any of you that wanted to attend to be there. I know that Tony Slonim will be there. This is something we're doing with Truckee Meadows Healthy Communities, and as the co-chair, he's going to represent tomorrow morning. I believe that Councilman Dare has volunteered, so good for you. And I'll get over there on Saturday. I think it's 5:15 in the morning that we're starting. So hopefully it'll be a good event and be able to provide those services to a lot of people in our community in need. Many of them in pain that need some relief. So.
Can I speak on one thing he mentioned on the community health needs assessment? I just always think it's important to take a moment to thank staff when something runs well. I got to go to that and listen and be there. And our staff represent well. I think it's awesome to know, and I think it's good for our board to know that our staff are leading our community in these conversations and doing a fine job of it. And it was an awesome time, and it definitely was eye-opening in a lot of ways, but it was neat watching. You had people from all different backgrounds, all different fields, coming to common ground and finding areas that we all know we need to focus on. And so, I forget what's the staff member who?
Heather Kerwin.
Heather, she did a fantastic job, and I was, she was up there, did the whole thing, ran it, spoke, and did her thing, and it was very good, very insightful, and it was good to be there. So good job.
Thank you.
I think we need to make sure that the staff levels get to hear, which is exactly because I know we have a very hardworking staff that sometimes it's pretty thankless sitting in your cubicle, but for the outside community to see what we do, I think that's very important. That maybe send a note from the board to the whole staff that thank you guys for another just great year and a Pacific good job on this. So.
Yeah, it was good.
Yeah. And
Yes, sir.
If I could add on to that, it's excited to see the final outcome for the community health needs assessment. I think that in many ways, I think our jurisdictions can utilize that tool a lot better in terms of even just our overall land use and developments. It's no secret that our built environment directly impacts our overall health, and more often than not, build a beautiful development, but we sometimes are not doing the best jobs in terms of how we directly correlate that with the overall health of our communities if we're doing that in the proper way, or even just the redevelopment or infill development in terms of how we can better utilize those, that data. Because sometimes we build out and then we go back and say, how do we make those changes? And so hopefully we'll be able to utilize that a little bit more in terms of all the jurisdictions on how we can always consider healthy communities in terms of those developments.
Good, thank you. Any other comments? Okay, item number 11, we're limited to announcements and issues by the board for the next agenda. Do we have any comments, things you want to see on the next agenda, updates or anything? Okay, I have two small ones. An update on the Excella itself. I know over the last couple of years, we've had a tremendous amount of problems getting this up and running, and let's just leave it at that. So if you can kind of get an update on where we stand with that. And being October would be a good time for me to get an update on where we are on my favorite project, which is accreditation. So just an update, because I know we have new personnel, so just, you'll do that. Do we have any other things that need? Yes, sir.
One thing I just wanted, I mentioned to Laura, I sent an email, the 2nd in November, our board meeting that we have scheduled is National League of Cities. I'm not sure if Oscar's going, I don't know who's all going to be here, but it's the week before Thanksgiving, but it is National League of Cities in North Carolina. So you might have a quorum issue and just something to look at, and quite possibly look at the idea of maybe we could move that, or I don't know, just want to let
Thank
somebody
you.
know.
We discussed that
Okay.
previously, so with that in mind, that there's a bunch of conflicts, so we'll deal with that as we move ahead.
So if I could get clarification, so it's the conflict is with our regularly scheduled board meeting in November, or?
Yeah, the one in November, we actually bumped it back because it would fall on Thanksgiving, so we did 1 week before, and that week before, we are just gone. Like I said, I know I am.
Well, we also have the retreat on November the 2nd, and we would need to see who's going to be available and who's not, because that's something I think, to me, is very important for us and the staff to move forward. If we have to move that, so we have a majority in quorum to work, I think that's important too.
Okay.
So, Ms. Laura, can you send out an email checking on everybody's availability for both dates, please? Thank you. Public comment. I've got one. Ms. Brandhorst?
My name is Kathy Brandhorst, and I'm also the United States President. I just wanted to let you know we are still having problems with Mexico. As you probably know, that we have been getting them down out of the United States, but not fast enough because there's lots of complaints. What are those complaints? Murder, bank robberies, robbing the department stores, robbing grocery stores. It's also robbing people's homes. They will break into your homes and rob whatever they want out of your home. Remember, these people are very, very poor people from Mexico, and they wanted to be here in the United States so they could steal and murder. Oh, excuse me. They are the poorest country, Mexico. And Mexico does have, a few people that needed to be destroyed in Mexico because they believe in living a very long, long life. And most of them that are still alive here in the United States are 1 million years old. And I just maybe heard that there could be 87 left in our area. So if you have the chance, to tell the U.S. military that we could use their help now, because they always come back. When they're 1 million years old, they come back as a snake. They could come back as a large animal, and they could destroy us because we don't know that they turned into the snake. And so we could use some help on that because these people are not human, as we call them. They need body parts. They need human bodies in order to stay alive. And they're doing that right now in the United States. Also, I just want to let you know the children are still needing help in the United States because they are very young kids. And they look young by the time they swallow the child or swallow the baby. They will look so young that we won't even recognize them. So always, remember that this could also happen. And the people that we are trying to destroy, dissolve in the United States, they are from Mexico. Thank you.
Ms. Brandos. Any other comments? It's time for an adjournment. Do I have a motion?
Move to adjourn.
Okay. Second. And Chief Brown seconds, so we're good. Adjourn. Thank you very much